is the creation of nonprofit health insurance co-ops. So remember when the public option died and everybody was upset, and some legislators got together at the last minute and worked this possibility into the law that the federal government would provide favorable loans to allow states to set up private nonprofit health insurance co-ops. And the law says that these companies, so these would be insurance companies that are nonprofit, that follow a co-op model, the law says that these companies can never be converted to for-profit. So these will always remain nonprofit companies. And the state government is not setting those up. It's up to each state advocates and policy people and business people in the states if they want to create their own nonprofit health insurance co-op. And in the state of Illinois, I'm very proud to say that there is an effort underway. It's called Simple HX, HX for healthcare, Simple HX, Healthcare Made Simple. So this is the nonprofit that has put in an application for a federal loan to create a nonprofit health insurance co-op, and it's a very rigorous process whether you get approved or not. And so we are waiting to hear whether we will be approved, but I hope we will, and if we will, then we have a whole new job to do, which is to get a new insurance company that'll be nonprofit, up and running and available in the exchange, and it should be much more accountable. The revenues from that will go back in to provide, even more coverage and better services, and there will be a lot more transparency and consumer governance by virtue of it being a co-op. So thank you. I had forgotten to mention that. Yes, sir.
You've broached the topic that I want to speak about a little bit. Up till now, you haven't really mentioned single payer at all. What comes to my mind is, for example, the state of Vermont is trying to set up a single payer system, and the question is, how relevant it is to other states. What is the possibility? But behind all this is a real problem, and it's not only in the United States, it's also in Europe, where they have more or less single-payer systems, namely that our system is about twice as expensive to the federal government as the other industrialized countries of the world. And the problem is, of course, is that we're depending upon the insurance companies. And if you keep depending upon the insurance companies, the federal budget for that is going to continue to go up. So what is your response to all that?
Well, yes, actually the Vermont possibility is created under health reform. Health reform does allow states to get waivers to create single-payer health insurance. I dare say politically it might be easier in Vermont than in the state of Illinois, which is like the home of the insurance industry you talk about. But it does create the possibility. But and I agree with your comments about the cost and all that. But one of the sort of counterbalances in the health reform law to that dynamic of private for-profit insurance companies and the prices they charge and all that is that Medicare is going to be strengthened, and it's something that those of us who are single-payer activists could focus on and work to expand. Medicaid is going to be expanded. Medicare and Medicaid are versions of single-payer. They're just not universal, but they are versions of single-payer. So we have, those things to work with. And then the nonprofit health insurance co-ops, I think, actually produce another possibility and opportunity there. It would be from the nonprofit sector as opposed to a governmental entity, but still a nonprofit sector. And if we can get those going, and I think there's 28 or so that have already been approved by the federal government, if we can get those going and get one in every state, they might be able to give for-profit insurance companies a real run for their money. And I know that's not single payer in the way that you're talking about, but I think all of those things create those possibilities for us. And we have to start, we have to start from somewhere. So, but wherever there's opportunities to still advocate for single payer or to create more of a possibility for it, we'll certainly be doing that as well. And I will take one more question and then let y'all go. Yes, Walter.
Claudia, CCHCC has a lot of marvelous programs, but the one that really turns me on is the hotline. How does the hotline work? Could you say just a couple of words and I'll get off?
Sure, thank you very much. Yeah, the Consumer Health Hotline has been around since like 1981. Mike Doyle would know better than I would. But it's a free service that we provide to the community where people can call us at our phone number, 217-352-6533, or just walk in with any kind of question or problem that they're having with the healthcare system. And our hotline is staffed by the incomparable Chrissy Torino, who had to leave to go back to work. She's the hotline coordinator. But we have volunteer advocates who work the hotline, who are trained and who work as advocates, working directly with people. And we get several hundred calls a month. Some of them are very simple calls, questions about, where do I go if I need this service, to very serious and important situations. We've had people call when they went to the emergency room because they fell and hit their head, and it turns out that they have brain tumors now and have cancer and they're uninsured, and how are they going to get their treatment. So we deal with all of that stuff. And so the hotline is a tremendous service that we provide, and from a service perspective, it helps hundreds of people and gives volunteer advocates an opportunity to really learn the healthcare system from the consumer perspective in terms of real life things that are happening on the ground. And from a community organizing perspective, it gives us the opportunity to understand policy and how it comes to life or doesn't at the grassroots level, how it affects individuals' lives, or what kinds of policy changes, whether at an institutional level or a local, state, or federal government level, need to be changed to make concrete improvements in people's lives. And so thank you very much for bringing that up.
Thank you.
And thank you all very much for being here today. I appreciate it.